Hello, let's look at another atypical bacteria and how we manage it. Leprosy and the drugs we use for leprosy. Now, when we say leprosy, basically we are thinking about a disease that affects nerves caused by mycobacterium lepra or mycobacterium lepromatosis. Now, leprosy is progressive, it develops slowly, but it eats away the ability of the person's nervous system to recognize a lot of activities. In other words, these patients may start losing the sensation in their body. And this loss of sensation actually is because the nerves are being damaged. And unfortunately, that also is a contributing reason for the damage that usually occurs with them. Because when they put their hand in fire, for example, they might not feel it. They walk on knife or nails or something, they might not feel it, and they end up hurting themselves. Fortunately, we have medications to also help get rid of this mycobacterium. So actually, a case of leprosy is defined as a person showing one or more of the following features. First, a patient showing macules, which are these hypopigmented areas or skin lesions. In picture, you can see these. These are macules. Or a patient that has a definite loss of sensation in their peripheral nerves. These two is what is used as a case to define leprosy, case definition of leprosy. And then a third is if the patient have shown smear positive. The lab indicates the presence of the mycobacterium. So any of these three or a combination of these three will tell us that the patient is having leprosy. Other signs that we could see due to these main features includes damages. And again, we said that has to do with the loss of sensation. So you sometimes see eye damages. It could be as a result of dryness. You see reduced blinking. You see some patients have lost their digits, as we saw in the introduction picture. You could see some nodules on the skin. Sometimes you could see ulcerations, disfigurement, especially facial disfigurement, have all been seen. Note that leprosy is transmitted through saliva or body fluids. It can be transmitted from one patient to the other through body fluids. Clinically, we put leprosy into two categories. And that categorization is basically based on two approaches. If it is the microbiology that is being checked, if we are looking for the smear, the presence of the bacteria in the smear, whether it's there or not, we describe that as microbiological approach. And in that case, we have smear positive and smear negative. If the result comes out negative, it is described as paucibacilliary. mycobacterium or paucibacilliary leprosy. And if the smear comes out positive, it is described as multibacilliary leprosy. You can also use clinical features to make the same informed diagnosis. And in this case, clinically, we check the skin lesions. So if a patient has a skin lesion between 1 to 5, it is described as paucibacillary leprosy. Now, if it is only 1, they can also call it single lesion leprosy, paucibacillary single lesion leprosy, but note that it is still paucibacillary. And if we have more than 5 of these lesions, then that is multibacillary leprosy. It's important to do this distinction of pauci and multi because it affects the choice of remedy or therapy that is used. So if you take paucibacillary leprosy, 2 medications, 2 antibiotics are used for management. Dapsone and rifampicin, the same rifampicin we saw in TB. So the same rule apply. Your patient should know that body fluid could be colored. Now, in treating of paucibacillary leprosy, the regimen can last for 6 to 9 months. 6 to 9 months, depending on how well the patient responds and how effective, if you like, our drugs show themselves to be. Now, in the situation of multibacillary leprosy, a 3rd drug is added to the first 2 we are using in pauci leprosy, clofazine. So now it becomes dapsone, rifampicin, clofazine. In the case of multibacillary leprosy, treatment can last for 12 to 18 months. Note that the treatment removes and gets rid of the mycobacterium, but any damage that has already been caused because of the presence of the mycobacterium will not be reversed. So before we gave the antibiotics, any damage that was already in the patient will not be reversed. So our drugs are not to reverse damages. The drugs are antibiotics that clear the mycobacterium. Again, note that leprosy or the mycobacterium involved, lepra or lepromatosis, is an atypical bacteria. Thank you very much for your time. The Lord bless you indeed, cause his face to shine over you. Have a wonderful, wonderful day. Please don't forget to subscribe to the channel for more videos. God bless.